welcome to Portal Orlando. Here we're gonna discuss a lot of different businesses and their perks and their challenges and everything that is happening to that world. Today we're here at Temple's Hair Restoration with Dr. Barusco, and we're gonna talk about a $53 billion market. Doctor, this is amazing.
It is.
But
good to have you here, Peter.
Thank you. But that raised up eyebrows as well, correct? Because if there is so much money in this market, what's happening? Maybe other not certified members are trying to get a chunk of this, right?
You're right. So I've been doing this for now 25 years. I started doing transplants back in 1998 when the market and everything was very different. There were only a few of us doing it, and so now the last probably 10 years or so, we've seen an explosion of the market. Many people coming into the field and then started to offer hair transplant and hair restoration services to take a chunk of that market, right? I mean, with the advent of the social media and people placing before and after pictures and hiring celebrities to endorse them, this thing just exploded. Not only here in the US, but all over the world. In Brazil, in Europe, everywhere. Things are going crazy right now. And with that, we're seeing challenges in patients that have been really hurt by inexperienced people, unlicensed people. So, we'll talk about that as we go forward. But it's been a dangerous thing too. For one side, it's nice because then everybody knows about hair transplantation. It's not a stigma like it used to be back in the day. Nobody wanted everybody to know about it. Now it's mainstream. But with that, the other side of the coin is that we're seeing a lot of surgeries being done incorrectly.
I'm glad that you mentioned Brazil because I was doing some research and I found that there was 2 deaths in Brazil. Also, there was an imprisonment here in Virginia. Because I thought that, well, Brazil, that's okay, that could happen. But here in the US, it is a thing as well, correct?
Right.
So what happened down in Brazil?
So, being from Brazil, and I have, knowing all the main surgeons all over the world because of the societies that I'm a member of and all the lectures that I give all over, we know what's going on pretty much everywhere. And I was recently with a group of friends of mine in Brazil, in the Dominican Republic. We were teaching there in a conference, and a lot of people from Brazil attended. So we got to talking, I got to know a lot of people, meet new people too. And that was one of the topics of the conversation, how the market there, it's really crazy. And it's probably one of the worst places, I think, nowadays, because what's happening is, if you go on the social media with Brazilian clinics, they are hiring celebrities, TV personalities, and they're bringing these people into the fold, and then they are using their name recognition and their status as a celebrity as an advertising tool. And so they bring a lot of patients to the practice, but the person that's actually doing the transplant may not have much training at all. So they're kind of skirting the rules a little bit, and these patients don't know, right? I mean, if you see a celebrity that's endorsing someone, you automatically trust them, right? That's a trust factor. And then when you go there and you come back with results, a lot of times it's not like you're supposed to be, because the doctor or whoever did the surgery is not experienced. Also in Brazil, we have a lot of biomedical people that are not really physicians or doctors. They are doing procedures, and that's a whole lot of legal things too. Same things are happening here in the US. Going back to the arrest of that doctor in Virginia. She was practicing there and didn't have a license to do it. She was doing hair transplant surgery and was arrested right in the middle of the procedure. So in here, we've been raising awareness all over the world, really, and we'll talk about the campaigns that are being done. But finally, here in the United States, every state is passing laws now regulating who can actually do hair transplant procedures, who can cut into a patient's scalp, who can do the things, because it's kind of the Wild West. Right now it's crazy. Another country that's terrible is Turkey. Over there, they're offering procedures very cheap, so it's attractive to patients. But then they go and, a clinic may be doing 10, 12, 20 surgeries at the same time. And, there are pictures out there on the internet showing how they are done, like patients with very little care for even basic hygiene, And so it's kind of crazy out there, and it's hurting a lot of people.
So what you get is what you see doesn't work in this kind of business, right? What happened? So you can say that right now there is a black market going on?
Yes.
And how bad is that?
Very bad. And it's getting worse. Again, so when you talk about black market, you're talking about, there's a few facets to it, right? So there are the use of unlicensed people to actually do surgery, and that happens here in the US, it happens everywhere, where you go and someone who is trained in assisting hair transplantation actually takes you to the room, anesthetizes your scalp, gives you drugs and gives you medications, and harvests the hairs from your scalp, puts them back in. You never see a doctor. These people are not even nurses, they're technicians. Sometimes they're medical assistants that have very basic training on anything, and they're doing the whole procedure, and patients don't even know that sometimes. We have someone actually locally here who actually tells patients, the doctor is not going to do anything, I'll do everything for you, And so it's gotten to that point, it's very brazen, And that's happening everywhere now. And patients are attracted because of the lower cost, and they don't understand that this, even though it's a, let's say, non-invasive surgery, it's not like, opening someone and doing a heart transplant or something like that. But you're still giving patients medications, you're giving them anesthesia, you're, cutting into their skin, there's, bleeding to contend with, and there's also the natural result. Hair transplant, if you compare to other cosmetic procedures like breast augmentation, liposuction, it's a surgery that's complex because it involves a lot of factors so that you can have the result that you're looking for. And also hair changes over time. Patients don't get more hair as they get older, we get less hair, right? And so if you're not accounting for that future hair loss, if you don't treat the patient's problem, or not a disease, because the hair loss that we all know, right? The male hair loss and everything like that is not really considered a disease, but they don't account for that. And I see patients all the time for consultations where they come in and they say, I went to 3 or 4 places, all of them recommended surgeries, nobody talked about medications with me. And I'm 30 years old, so I'm like, okay, the first thing you need to do is you need to be on medication. Surgery should be your last option, because a transplant doesn't really treat your hair loss. What treatment is the pills and the medications that we put you on, so that in 10, 20 years, you're not gonna be bald everywhere else and just have the surgery there. So patients are not even getting the right recommendation, and because to understand that, you need to have understanding of, physiology, anatomy, diseases, pathology, all the stuff that we learned during medical school. I'm a hair transplant surgeon, but I didn't forget all my medical school classes, right? So every time I see a patient, it's my obligation to make sure that they have a treatable problem. If you look at a textbook, the list of different types of alopecias or hair loss, it's extensive. And patients come to us with all sorts of them. So I need to first of all diagnose what they have, and that's what we see too. Patients that have had procedures and they were misdiagnosed. So the surgery didn't work. It actually caused more damage to their skin and their scalp, because it was a condition that was not supposed to be treated with surgery anyway. But these people don't know, because everybody that has a bald spot, it's a candidate for surgery in their eyes.
We're not going to even open the Pandora box with all the worms.
I can talk about this forever, as you can see, right? As you can tell.
Because I know that it's not just for hair transplant, but for every kind of medicine. Most of the doctors, or a lot of doctors, do prescribe some drug. You talk a lot of property about the information. Mm-hmm. So can you tell us a little bit about your curriculum, about your background, just for us to understand the powerful message that you're giving and support that?
Okay. So like I said, I've been doing hair for 25 years. Back in 1998, I came from Brazil and I started to learn this, and then I was invited to work with one of the leading surgeons in Orlando. He's now semi-retired, but I worked with him for 12 years in his practice, and then after that he sold his practice and I decided not to stay anymore, and then I opened here. So we've had Tempus for the last 13 years, since 2010. ever since the beginning of my career in hair, I was fortunate enough to start teaching people and doing speaking engagements. This doctor that trained me, we used to run together one of the most famous live surgery workshop events at the time, and we ran it for 20 years, and I was a very big part of that, organizing it, lecturing, doing surgery to show people how to do it. A lot of the surgeons that are now maybe doing transplants for 20 years or less, they actually learned or had sometimes their first exposure with us here during that workshop. It was very popular. And then over the years, I've always been involved with the International Society of Hair Restoration Surgery, which is the main worldwide society for hair. Also the American Academy of Cosmetic Surgery is another society that conglomerates all the cosmetic surgery specialties in the AACS, the Cosmetic Surgery Society. I'm currently their secretary, so I'm in the path of the presidency in a few years. And the International Society of Hair Restoration, I've been part of many committees, and I'm still very active there. So I've been board certified by the American Board of Hair Restoration Surgery, which is, you go through a test, an exam, right? A written and an oral exam, and they will pretty much certify that you have the basic knowledge and everything like that. So it's like getting a board certification in internal medicine or cardiology. It's like a validation that you have what it takes, right? You're a competent doctor and a safe doctor too. And I've been certified or board certified since 2001. So it's been 20 years. We have to recertify every 10 years. And in the board, I've been part of their committees. I've been past president. I was president in 2017 of the board. Every year I examine candidates, so I'm an examiner for the oral exam. And so, I've been very active in this field in many, many different things. So it gives me a good idea of what's going on out there, because, when you're putting these conferences together, you invite people to speak. Not only you get to know them, but you get to hear what's going on in their little market, in their little area of the world, right? So that allows me to have a very global vision of what's going on, and it worries me. It's been worrying me for a while.
So doctor, with all this information and all the knowledge that you have, who's legally able to carry out the hair treatment? And I want you to give this message to our camera too.
Right.
And I'm going to ask our director Guto to just stay at this camera.
Right.
Tell
Okay.
our listeners who is able to do it. What is your advice?
So for you that's out there listening and you're looking for information on hair transplant surgery, in the United States, I'm going to talk specifically here, but I know in Brazil it's the same way. But here in the United States particularly, you have three professions or three professionals that are able to actually cut into your skin and harvest hair from the donor zone and actually make incisions for these hairs to be placed in the recipient area or the balding areas. Those are MDs or DOs, right? Doctors, physicians. Nurse practitioners that have, of course, been trained, and the doctors also that have been trained in hair transplant surgery, and physician's assistants. Now, physician's assistants are different than medical assistant. Medical assistant is someone who went to school for a little bit and they learned the basics of helping a doctor during the practice. Physician's assistant, they are actually able to see patients, prescribe medications under a doctor, and the same thing with the nurse practitioners too. So those three professionals are able to work on your case and actually be responsible for your procedure. If you don't see any one of them during your surgery, then the surgery is being done illegally and unethically, to say the least, right? Because as a physician, it's my responsibility to take care of you, to be the leader of the team. Now, every one of us work with a team. I have technicians that work with me. I have a team that helps me during the surgery, and the key word here is helping. They don't perform it. Everything is under my control. I decide all the key parameters, and that's not only an ethical obligation that I have with you, but also a legal obligation. The doctor that was arrested in Virginia, as we talked before, she was performing without a license, and these medical assistants that are doing these procedures are practicing medicine without a license. They are diagnosing your hair loss, and sometimes the incorrect diagnosis. They are recommending a procedure for you. A lot of times patients go to a consultation and you don't even see the doctor that's going to be doing it for you. You see a consultant or someone who's been hired by the practice to actually see you. Well, again, probably 75% of the time, they're going to give you the right recommendation or something a little close to that. But there are types of hair loss that are not transplantable, need to be treated different, and these people may not be trained to diagnose correctly. So 2 things you need to ask when you go for a consultation anywhere. Number 1, is a doctor going to see me for the consultation because I need to have a correct diagnosis for my hair loss? And number 2, if I decide for surgery with you or your practice, who is actually going to be doing it? Is the doctor going to be in the room doing the procedure, or is it going to be done by technicians? If you don't have the right answer for these 2 questions, then I recommend that you stay away from that, because the consequences can be very difficult to fix and they can cause permanent trauma for you. We're talking about your hairline, your hair, sometimes your eyebrow, your beard. So it's your face, you know. You don't want to risk that by not having someone with experience, working on you. So that's the message.
So yes, I'm going to ask for a doctor. It's the doctor's going to see me, but how the hell would I know if this is the right doctor?
That's a great question too. So again, to the public, to you out there, when you go look for a doctor, or if you are thinking about scheduling a consultation, look for credentials, but not just credentials where they go to medical school and anything like that. Credentials in hair transplant procedures and hair transplant training. Most of the doctors that do this with any kind of dedication, they're going to be members of the International Society of Hair Restoration Surgery, the ISHRS. And if you want to look it up, it's www.ishrs.org. There's a feature there called Find a Doctor, and you're going to see the doctors there. Now, just being a member doesn't mean that automatically qualifies someone, right? So look for the membership category. They have what we call fellow members. Fellow members only achieve that status within the society if they fulfill certain criteria. We have to have many hours of continuous medical education in hair transplant surgery. We have to have sometimes board certification in hair restoration surgery. So as far as I know, only about 10% of the ISHRS members are current fellow members. I am lucky enough to be. So look for that. Look for board certification in hair restoration surgery, the American Board of Hair Restoration Surgery, ABHRS, again, www.abhrs.com. And there you can find also, there's a feature to find a doctor. You can see who is board certified. Having the title diplomate of the board or certified by the ABHRS means that physician, before they even can sit for the test, we have to prove that we do enough cases. There's a minimum amount of surgeries you have to do within a certain period of time to even qualify to sit for the exam. And we go through a rigorous written and oral exam to prove that we know what we are doing. And I'm an examiner, so the exams they're not easy to pass. And so to pass, you have to demonstrate that you're not only a safe surgeon, but also that you know what you're doing. And so if they have that diplomate status or certified status, that means that they are dedicated to the specialty. What happens a lot of times, like I said, I go to about 3 or 4 international congresses every year to teach and to learn. And a lot of guys that are offering hair transplant surgery, I never see them in these meetings. If I don't go for a year, I already feel like I'm losing and that I'm behind on what's going on, because yeah, it's only hair, but things change constantly, right? And so I don't see these people out there in the meetings, so they're probably doing things the same way we used to do, like probably 10 years ago, and they haven't been able to keep up with the technology because it's just not the priority for them, Another thing that's important too is to make sure that doctor or that team does hair transplant surgery as a very big part of their practice. That's all I do here. Do a little bit of Botox and fillers, but all we do is hair transplant surgery. I don't do any other procedures or main procedures here. So that's what you want to look for. If someone only does that specialty, he's going to be better than someone who is something else and then has a side practice in hair transplant surgery. Maybe does one surgery per month or one per week, whatever. We are here operating every day, and we have been doing so for, again, 25 years. So those are the things to look for when you're looking for someone for your procedure.
So a plastic surgeon is not the right doctor to give you diagnosis and treatments and prescriptions and even be in the room operating, right?
Not necessarily. I mean, so you can have a plastic surgeon or a dermatologist or whatever specialty, and they learned hair transplant surgery. They had training. That's part of what they do with enough frequency that they know how to do it, right? They know how to diagnose someone. So the specialty doesn't really mean much. It's more how much of the hair transplant surgery is part of their practice. I have a lot of patients or colleagues of mine that are plastic surgeons, dermatologists, urologists, you name it. But they went through the training and they do a lot of hair transplant surgery. Sometimes that's all they do. So their main specialty doesn't really matter at that point. Conversely, I have guys that I know or people that I know that are plastic surgeons, dermatologists, and they do that. Then they have if I see someone with hair loss, I'll do a transplant for them. But it's not the main part of their practice. They may be well known for liposuction, for rhinoplasty or facelifts, and then they also do hair, So you have to figure out how much hair is part of their practice, because to be good at this, to have a good team, it requires consistency, like anything else, right? The more you do, the better you become.
And why this information is not out there, easy to get? Because you talk about go to certain website and search for your doctor, and of course we know that we are kind of lazy. Our brain doesn't like too much work,
right?
Especially if I'm going to do something that is for my ego or for my appearance and going to satisfy me, but it's not something that is mandatory. And before, even I didn't know that somebody could die out of this procedure. So how are you guys dealing with this kind of not having this information? What are you doing to have this information out there?
So I don't know, it probably been 4 or 5 years ago, maybe a little longer, the ISHRS started a campaign to address that. So 2 things were done. We started what we call the Black Market campaign, or now it's called Fight the Fight. So it's a worldwide push to educate consumers on these things, right? So we are doing from the ground up. It's like a very difficult process, because you have to fight all these people that are out there putting thousands and millions of dollars into the marketing for their procedures, right? And attracting a lot of patients. We have to start a grassroots things where all the major hair transplant societies from around the world, Brazilian, Italian, British, you name it, we all came together and we formed what we call the Global Council of Hair Restoration Societies. So it's a council that aggregates the main societies of hair all over the world, and we pass policies and we contact politicians. We try to lobby state legislators like here in the US to pass laws to protect the public. But it's very difficult and it's very expensive too, particularly when you're fighting this very spread out fever now with the hair transplant industry. We are making progress. This arrest of the doctor in Virginia is an example. Here in the US, there has been some action taken against people that were advertising procedures without the doctor performing it. But we have a long way to go. It's very difficult. And what you're doing here is very important, because this gets in your channel, maybe my YouTube channel, and then somebody else sees it. So we are noticing that patients are asking now more often, who is actually going to be doing my surgery? You, or who is a doctor going to be involved? And a lot of them have that no as an answer, and then they go away. So little by little, we're making progress. Still a lot of work to be done, but there's a strong force of us, like the main guys that are now out there looking to protect people, to protect patients, that we're doing it, and it's gonna work. We just have to get more outlets like you, try to get in front of more people.
And that's why we're here. So look out for information about that. So doctor, just putting myself in the patient's shoes. Why do I go to uncertified places for money, for price, because I'm doing the some facelifting with my plastic surgeon, and I didn't even bother to ask if he knows what he's doing. I just go out of trust because he did the procedure right in my face. So what are the main reasons for somebody to go for this black market per se?
Unfortunately, one of the driving factors is price, right? If you visit a few people and somebody offers you a great deal, then you're like, okay, I'm going to look into that maybe a little bit more favorably, right? And we have the old saying that you can't have cheap and good at the same time. You can have one or the other, right? And that's true with everything, including hair. So yeah, I think that's one of the driving factors. Also, when you go for a consultation, of course, so you're in a research phase, you take things from someone sitting across the table from you who supposedly knows what they're talking about, you're going to believe it, right? We tend to trust people, right? And that's a lot of things too. These places prey on the patient's misinformation or their trust. And then they get them to go through the procedure. And then if there's a problem, they're not there anymore, then they come to somebody like me that now, oh yeah, I had a bad experience and now I'm gonna give you a second chance to try to fix my thing, the thing that wasn't done right. And I'm talking about me, but this happens everywhere. So I think money is one, and then people tend to trust someone who looks to be a professional, and everybody can talk a good game, right? I mean, we all can, I guess, if you have the gift of gab, you can convince people. And unfortunately, a lot of times they don't have the patient's interest in mind. They're looking at the bottom line and the money,